All right, folks, can we get started, please? Take your seats. Thank you.
That's all bang things.
More opportunity to discuss in the wine session later tonight.
Oh, that's Sophie.
Is she here? Oh, great.
I was quite surprised that she would be accepted on Sanitation this week, so the fact she's here, that's...
Yeah, that's good.
Yes, we are starting. Yeah, see that.
All right, folks. We'll be starting up again now. Thanks, everyone, for coming back from lunch. I hope you enjoyed the food. It was obviously a tasty meal because everyone's in good spirits, which is good.
Is yours working?
I think it's working, yeah. So we'll kick off on the next session now, which is entitled Sanitation Market Analysis and Strengthening. My name's Julian Dotsey. I'm a senior research officer here in the Overseas Development Institute in the Water Policy Program. And this session now will be sort of exploring a bit more the tools that are available to us for market mapping through two presentations that will illustrate them a bit more. The first being from Ms. Lucy Stevens here of Practical Action, who will be speaking to us about participatory market mapping and urban sanitation market development. And the second from Mr. Jonathan Parkinson of Oxfam, who will be speaking of using these types of tools in the context of the Philippines after Typhoon Haiyan. So again, it will work similar to Katie's session in the morning. We'll have each speaker speak for about 15 minutes, followed by a brief Q&A after each presentation for questions of clarification. And then we'll save the kind of meaty thematic questions for the panel debate, which will take place after the tea break, facilitated by Rick Bauer. So without giving you too much detail, I can introduce the first speaker, Dr. Lucy Stevens, who's a senior policy advisor in WASH with Practical Action. And she'll be speaking to us about how she's been transferring knowledge of participatory market systems development from agricultural value chain to urban sanitation and reflecting on what they've learned so far. So without further ado, Dr. Stevens, take it away.
Okay, thanks very much. Yes, what I wanted to share with you today is a little bit of what we've been learning from some of the examples that we've already talked about today, especially drawing on some of the work that we've been doing in Faridpur, which Noemi talked about and has been really a joint effort of a lot of people in Practical Action. So I'm going to share with you a little bit about a tool and our approach to our thinking and how that's changed in urban sanitation markets. Let me see if I can make this work. So I guess just by way of introduction, Practical Action, we've been working on issues to do with urban poverty for probably 20 more years out of the 50 years. We're 50 this year. And our WASH program focuses on the urban poor specifically, so we feel like we've got some expertise in that area. Am I going to be able to make this work? The right one, that one there. Okay, all right, so great. So we've been talking a lot about the sanitation chain today, and as that moves from containment through to reuse, and the opportunities and barriers to working with different market actors along that sanitation chain. Practical Action, like as Julian said, we've also had a lot of experience in working with agricultural market chains and improving the lives of poor producers. So that might be, for example, the dairy market or dairy cows in Nepal. What are some of the differences? What we've tried to reflect on, what are the differences with those kinds of markets? I guess in agricultural markets, you've got large numbers of poor producers, whereas in sanitation market, you're more talking about the consumers of a service. And in agricultural markets, it's the producers who are the main people we want to benefit rather than, the people who are trying to achieve a good sanitation coverage. There are some generic steps in the value chain, and also in agricultural markets, they're often quite well-established markets, whereas in sanitation, we might be talking about emerging markets or markets with potential rather than existing demand. We've codified a lot of our experience in agricultural markets in something called our Participatory Market System Development Roadmap. It's available online, and it takes you through different 10 steps in a process which helps to identify barriers and opportunities in market systems. I think the key thing about it is that it tries to think in a systemic way and it tries to think about how you change relationships between market actors through a participatory process, and I'll come back to that later. The framework, it comes in 3 levels. This is a generic market map, and on the left-hand side, you've got people who are buying a product, and on the right-hand side, in the middle, you've got the people who are making or producing a product, farmers. Underneath, at the bottom, you've got the business services that they might need. They might need financing, they might need market information, and at the top, you've got an enabling environment which includes policies and consumer trends. So it's basically to say that where we work on market systems, we can think about 3 levels: the value chain in the middle, the services, business services, and the enabling environment. So how does that work when we're thinking about, how does that map onto thinking about sanitation chains? What does it mean when we try to apply that learning and that kind of a system to our thinking about sanitation? Well, one of the challenges is that there are lots of interacting market systems across the sanitation chain that goes from containment to reuse and disposal. So we've talked today that actually there's a service chain. So households are buying the service of pit emptying. But potentially there could be a value chain for that sludge. So it could, if you can sell the sludge for something at the end, it can you can turn that service chain into a value chain. So there's both a value and a service. Then you could if you sell that sludge as compost, then there's another value chain for compost. At the same time, we've talked about artisans and construction of toilets. You can have a value chain for toilet construction, or sometimes those operate as a service. So you've got a service of people paying as you go to use toilets. So you can have lots of different interacting market systems across that sanitation chain, which are both value chains and service chains. So let's just kind of slow down and try to understand what that means. If you're thinking about a value chain for an agricultural product, here's a really, really simple way of thinking about it. You've got, people probably enjoyed some apples at lunch, right? So we can think about apples. You've got a producer who grows apples, a trader, and a consumer who eats the apples at the end. And the arrows go that way because it's the value chain shows the flow of money from the consumer who pays the trader, who pays the producer. And the product itself, the apples, are going the other way. What does that mean when you think about some goods that there's a market for in a sanitation chain? Well, there might be a simple value chain for toilets where a consumer or a householder is buying a toilet to be constructed from a builder. So fine, it's quite a short chain. One of the differences, though, is in who we want to benefit. In agricultural value chains, we're trying to bring benefits, or the people whose lives we want to improve are mostly the poor producers, the farmers. But in sanitation, we're trying to improve the lives of actually often the consumer households and a little bit the artisan builders. So there's a difference in actually who we're trying to bring benefits to. If we think about what that means in a service rather than a product or a good, it's slightly different because people are paying for a service. So the money for pit emptying goes from the householder to the pit emptier, and they're basically only prepared to pay for a certain part of the sanitation chain, for the pit to be emptied and it to be taken somewhere, but they're not really prepared to pay for the full thing, for it to be the treatment and reuse and disposal. And actually, because the product isn't valued in and of itself, it's the service which is valued, the sludge is going in the same direction as the money because it's the service that people are buying and that people are valuing. So the question is, can we create value for the product so that you can cover the whole sanitation chain? And can we get householders to value the public goods as part of the service that they're being offered? I guess the other point, and a big difference that it's worth bringing in here is that, as we've seen with a lot of the conversations today, these chains are not entirely private sector driven because local authorities are often active at different parts of the service chain. And clearly, there's been a lot of conversation about, the holy grail of trying to give sludge more value so that service providers are both providing a service and selling a product to make the whole thing more commercially viable. And so money can start flowing to the pit emptier both for the service of emptying, and somebody can pay them for that sludge that they've then collected. So if that's the sort of framework and a way of thinking about things, what does that actually mean in practice? What does it mean in practice? What additional insights has using that kind of a framework brought us? What are its limitations and challenges? Naomi spoke a bit this morning about the work we've done in Faridpur on fecal sludge management and trying to apply some of this sort of thinking into that situation. Faridpur is a secondary town in Bangladesh. It has about 130,000 people. There is no sewerage system whatsoever in the town. It's entirely on-site sanitation. But as with a lot of Bangladeshi urban contexts, there's been quite a significant push to get coverage of sanitation. So actually quite a lot of households do have access to some kind of toilet. The problem is what they call in Bangladesh a second generation problem, because there's no effective emptying. And a lot of the pit emptying that does happen just empties the toilets directly into the drainage system. So there are 4 key problems that we're encountering here. Unsafe containment of the sludge at source. So 30% of households connect their pits and tanks to storm drains. So there isn't proper containment. There's a toilet, but it flows directly into a drain. For those toilets that are emptied, that sludge is unsafely disposed of. It's just tipped into the nearest drain or into an open space. Occasionally it's buried, but whether that's safely or not is another question. So the ship flow diagram I can show you in a minute shows that only 10% of the sludge is actually safely managed at the end of the day. There is a lack of capacity in collection and transportation, or in other words, the potential market for emptying isn't really being covered right now, because only 55% of households use a pit emptying service, and only 30% of the cases where they should empty the pit is actually being served. And there's a lack of regulation and national coordination over how this whole system should work. So the ship flow diagram shows that, yes, there's a lot of on-site sanitation, 94% coverage, but a large proportion of that is left to overflow or they're abandoned, and only 10%, and a lot of emptying into the environment, and only 10% is safely treated. So what was the kind of system? If we were thinking about incentives, if we were thinking about how to make the system work more effectively, what did we do to try to get value to the pit emptiers and to create a value chain as well as a service chain? So FS means that you can see the sludge is moving from the households at the one end all the way through to composting and reuse disposal at the other end. The pit emptiers are paying, the households are paying the pit emptiers to empty their sludge. But at the same time, they need an incentive. They need to be paid to take it to the treatment centre, because otherwise it's not worth their time in the transport and whatever to actually do that. But at the same time, it's really difficult for them to do that if they don't have little trucks or small vehicles that can help them to take it there effectively. If they've got to do it manually, then there's no way that it's going to be worth it. So the municipality used to has traditionally done some of that pit emptying itself. At the same time as there being 2 groups of informal pit emptiers working at the same time. People prefer the informal ones because they're quicker to access, and they do the job more quickly, and they can access hard to reach places. So the municipality is now going to be operating to lease the informal sector some better equipment so that they can do the job more effectively. And at the same time, the idea is that selling compost would be able to pay for the treatment, but we've realised that whatever kind of business modelling we did, the sale of compost is never going to cover the whole cost of paying enough to the pit emptiers to make it worth their while bringing the stuff to the treatment centre. So the municipality is also paying the treatment centre for the amount of waste that it collects and treats, so that that can top it up to make the system work. So there are incentives, and the municipality is beginning to change its role and spend its money in a different way than previously. I was going to talk very briefly about how this system works differently in a context where you don't already have a lot of toilets available and you need to increase the amount of toilets. I'm not going to say much about that now for shortness of time, but I think there's a lot more that we've learned in Kenya where there wasn't access to enough toilets, about how you need to work on multiple fronts, not just with pit emptiers, to create a more sanitary environment, which we've done through applying a CLTS approach in Nakuru. So just to wrap up with some of the key lessons that I started by saying, what have we learned? What are we learning? And what added value does it bring to use some of this kind of systemic markets thinking in some of our work? So a few thoughts was that it's helped us to some of this systemic thinking to think right across the value chain, but to think in terms of incentives and what the different roles of different players should be, is that it's really helped us to identify some key entry points and some new solutions about how we could put the right kinds of financial and other incentives into the system. It's shown us that, as has been emphasised quite a lot today, there's a continuing role for the municipality, and that there will be a need for investment of municipal money. And in Faridpur, the municipality was already spending money on its pit emptying service. But was that really the best use of its money? If the ship flow diagram was showing that the municipality was only collecting a tiny proportion of the entire volume of sludge, was that really the best use of the municipality's money? Can't we make better use of it to actually create a better impact at the end of the day? There is a benefit of working with existing market actors and thinking about the incentives which are going to drive them, and that, you know, the role of practical action should be as a facilitator rather than as a direct market actor. And that's actually quite a challenge, I think, because quite often we have worked in situations where we would have more directly, you know, built toilets, more directly supported enterprises in the market chain, and we're trying to think about how we can be more of a facilitator and less of a kind of direct market actor, while at the same time doing some capacity building. It's quite a tricky balance. The challenge is this business of there being multiple value and service chains, and so there is quite a bit of complexity, but how do you simplify that into what are the key entry points? That's the challenge. It's a challenge to sort of change the mindset and ways of working of different people in the organisation, our organisation, and the expectations of communities about how NGOs will operate and what they can expect of them. And also, I think that in these kinds of markets, a lot of the actors are highly vulnerable, and that's a challenge in itself in how to work effectively with communities that have been traditionally so excluded and are so vulnerable in an effective way, which isn't going to further marginalise them. So thanks very much, and if you want to find out more, you can follow me on Twitter. There are my contact details. Thanks.
Great. Thanks very much, Lucy, for a very insightful presentation. We have a few minutes now. If there are any questions for Lucy, questions of clarification or initial items for debate that you'd like to kick off on. I have one here, there. Any on this side of the room? No? And so you start with Frank. Yeah, go ahead, Frank.
Great. Lucy, thank you very much indeed. My name's Frank Greaves. I'm a workers' wash lead for Tier Fund. Lucy, I was really pleased that you got into the, if you like, the demand creation in terms of incentives on behalf of the users to just take up good sanitation. And you even mentioned CLTS at one thing. So this really interests us as an agency. In the actual sort of behavioural change push, because we've talked so much about pull this morning, what actors can do, what the market can do. But in the push to change behaviours, and this was touched upon by Jenny as well this morning, the willingness and ability to pay, that side. I'd be interested to know more about the links of the sanitation marketing with those processes, and perhaps even you might be able to suggest how your findings, the learning can cut in to the very process of behavioural change, so that what's the old model? Demand meeting supply, the classic sort of sanitation marketing sort of models. Do they still apply? I think out of all the speakers today, you're the nearest to have touched on it with your examples, and I'd love to know more of how we can get that behaviour change to link those different methods like CLTS to really link with the marketing model.
Thanks, Frank. We can just take a few of them in sequence, and then Lucy can hopefully respond. The gentleman there, Mariana. Oh, okay.
Sorry.
I'll be very brief. It was just a question about your comment about how do we get consumers to value the whole chain as part of the service. And my question is that where regulation comes in to say, the full cost should be factored in. It should be harder for suppliers to provide the service without factoring in the full cost of the value chain, rather than, is that a role for regulation rather than for trying to persuade people of the benefits to them?
Thanks, Tim. Gentleman here.
Hello, I'm Eric Bartings from IRC. Very simple question. You showed one of the first slides that containment was a problem for 30% of the households. I thought, wow, Bangladesh, you're doing pretty good. Because I've been to places in, this year in Bhutan and in Vietnam where there's 50% and over, where basically, the human waste disappears on site, up to 80%. In the case of Faripur, it's still 30%, still a big proportion. What is the program doing to try to improve on-site containment?
Time for one more. Anyone? No? Okay, take it away, Lucy.
Very, very briefly on this question, yes, that there are some poor toilets. So there's quite a lot of toilets that are left this part here, where this part here. So either the toilets are just directly empty, 30% directly are linked to a drain, and the rest they're not directly linked, but the septic tank or just is kind of overflows. So that's why it's a bigger amount there. And the program has been in other ways trying to promote better models for containment. So maybe joined septic tanks between a few households where there may be a cluster, and gradually trying to upgrade and improve the toilets so that the containment is safer. And actually linked to Tim's question about valuing the whole sanitation chain, there's also a need to persuade householders not to just let their toilets overflow, to actually get them emptied. Some of them do, you can see, but not everybody gets their toilet emptied when it needs to be. Some of them, they just let them overflow. And so there has been a bit of public awareness raising about the need to try to improve the containment part of your, a better quality toilet, upgrade your toilet, and not let it overflow. But at the same time, I think you're unlikely to be able to persuade. I think there's a role for raising public awareness to try to get people to see the value of a better service, which is a cleaner service, which doesn't just dump the waste that they've emptied really close to your house, to actually take it a bit further away. I think you can get people to value that, because it does kind of pollute your fairly near neighbouring environment. But at the same time, I don't think you can expect people to pay a lot more for that. So you've got to try to find other ways of paying for the rest of that, which may be the role of municipal money to help to pay for some of that, as well as the role of a small portion of that being paid for from the value of the product that you may then be able to sell, something with it at the end of the day. And in terms of Frank's question about behaviour change and how you can link that with marketing. Previously, when we'd worked we've worked in Nakuru for quite a long time, over a number of years, different efforts over time to try to improve access to sanitation, get people to their tenants here. Basically, people are tenants. To try to improve the sanitation situation for tenants. And in the past we thought, right, well, the problem must be a financing problem. So we'll work with landlords and we'll offer them finance so that they can take up toilets. And we were really pleased when we got to 50, 100 toilets. I mean, and these are communities of 180,000 people. That's a drop in the ocean. And we really began to ask ourselves, what is it going to take to do this at a bigger scale, to create even a small section of these communities that you could declare open defecation free. Not that there's open defecation like you'd understand it in a rural context, but proper access to sanitation, enough toilets to the number of people that use them. And we found that an adapted model of CLTS helped generate more demand from the tenants, but also from the landlords, and you had to work with them separately to kind of give them different reasons and arguments for why they should be putting their money into sanitation or demanding from their landlords better sanitation. But that really, really helped to create that. And at the same time, we needed to work with the artisans to get them set up so they could deliver that, and a little bit of financing availability from banks. But you had to work with the artisans, and we got some standard designs approved by the municipality, which really helped speed the process up. So we co-created with people standard designs that were then approved. So the landlord could go to the municipality and say, I'm going to build this one out of that 6, just sign it off here, and then they could go more quickly. So that was something that helped and brought the two things together.
Great. All right. Thanks a lot, Lucy, for that. I realize that I've neglected my online audience. There haven't been any questions so far, but if you are watching online, do feel free to pose questions to us and we will answer them. I will turn now to Dr. Jonathan Parkinson for the second presentation. Dr. Parkinson has a PhD from Imperial College, urban wash specialist, and recently joined Oxfam, previously as a consultant with various organizations. He's kind of the brainchild of this event in terms of its thematic focus, and is doing a lot of work on market mapping with a new USAID project that he has. But this presentation that he'll be focusing on today is from the work of Oxfam in the Philippines, using market mapping in the post-Haiyan context. Dr. Parkinson, take it away.
Thank you so much. Great. Okay. So yeah, I'm going to look more at market-based programming rather than the title in the agenda, which was more around the market mapping and analysis. 2 reasons for that. Firstly, I think in the interest of time, I didn't want to go into so much detail. And secondly, by now I was hoping to have had a visit to the Philippines and would be able to give you a more detailed perspective of what the mapping and analysis was. My visit was postponed. And I thought in the interest of today's agenda, what I want to aim to achieve in this presentation is not for you to have so much detailed of the methodology adopted in Philippines, but to be thinking about Nat's presentation earlier about resilience and thinking, I think this is new to the agenda. We've had quite a lot of discussion around market development, market strengthening, but what I would like you to be thinking about is what happens in urban contexts, which is increasingly common, as we know, in disasters in urban situations. What happens to those markets and how organisations like Oxfam responds. So I'm going to sort of talk you through the development of our approach. And I should say that Esther Shaler, who I hope is listening, she's been instrumental in helping me prepare this presentation. So Typhoon Haiyan, or Yolanda as it's known in Philippines, hit. Can we have the first slide? Do I need to?
Oh, sorry. This one.
Okay, the font's very different from what I've got, but hopefully you can read it all right. It was a lot bigger. So I think it goes without saying that big natural disasters like Typhoon Haiyan have massive implications on urban populations, their access to sanitation, and the impact that these disasters have on sanitation facilities and infrastructure. And it also goes without saying that this therefore has massive implications on human health and issues related to dignity. So that's our starting point. Oxfam responded to this in at the end of 2013, throughout 2014, and then at the end of 2014 there was another typhoon. So this is our traditional sort of humanitarian response: water supply, provision of bladder tanks, trucking of water to relocation sites, and distribution of water kits. That's for water storage and chlorine for water quality issues. Sanitation is about constructing emergency toilets in relocation sites, helping households rehabilitate their toilets, and septage management, which is not something I'm going to go into much in the presentation, but we've got a sort of parallel program which is sort of complementary to a lot of this, which is about improving the septage management in Philippines. And hygiene, provision of hygiene kits, hygiene promotion kits. So I think if you think about the emergency situation, there is a need to respond fast, and these are the sorts of things that NGOs like Oxfam does. But there are issues here that we need to consider. Similarly, in development, it exacerbates dependencies on external assistance, which then leads on to challenges for exit strategy. So NGOs are continually challenged by the fact that we respond to disasters, but then there comes a point, essentially, and it comes back to funding mechanisms and the different donors involved, but it comes a point when we can't continue with that line of funding. So what do? We either try and exit out and hand over, or we look for other sources of funding to carry on. But this is a big challenge. I think very importantly, it sets up parallel supply chains, which weakens government agency involvement. So we are in effect establishing supplementary supply chains and not really working as much as we should be with government agencies. Obviously we try to, but in emergency situations that can be challenging, and if our mandate is saving lives, then we often have to rush ahead, and that means there isn't as much involvement as there should be, and ultimately this undermines market rehabilitation and economic recovery. I can't remember the statistics, but it was quite alarming, thinking about the response to Haiti earthquake, and I was reading how much money had been spent on the emergency response, and how after 5 years or so, the markets in Haiti were still pretty much on their knees. I think that really does exemplify the issues of emergency response and not working to establish markets in the process. So we want to be looking at trying to do both, save lives, but also re-establish markets for longer-term development. In the Philippines, the initial response to improving sanitation moved on to a national strategy called FATS, Philippine Approach to Total Sanitation. So this kind of embodied elements of CLTS, but also looked at demand creation and building up the supply chains, and also working with local authorities for area-based sanitation improvements. I think you'll all be familiar with this sanitation ladder, and this was integral to FATS in looking at ways in promoting on toilet facilities to appropriate parts of the sanitation market in line with affordability and demand, and supporting supply chains to actually produce those. So on the supply side, this involved assessment of local manufacture processes, market assessment looking at material cost availability, development of a a range of toilets for different markets, training, and you'll see there the particular emphasis on encouraging female masons for sanitation service delivery. One example of that was to enable childcare for enable livelihoods, women to gain access to livelihood opportunities. And that's just that just shows a range of the different toilets. And then, so the sanitation marketing was effectively around promoting this range of sanitation toilets, obviously combined with health awareness, promoting the health benefits, but enabling households to learn about the range of different toilets and the costs so that they could access the system, the facility that was most appropriate to them. Right, George, where are you? Is he still here? Oh, that's a shame. This was not intentional, but there's a picture of WHAM, and this was, yeah. So WHAM, on a serious note, is what is currently referred to as the Sanitation Marketing it's the current title of our Wash and Markets program. So this is like Sanitation Marketing Plus, and I perceive this to be an integrated market-based programmatic approach with three elements. One is support to beneficiaries to enable them to procure wash goods and services. Another was on supporting sanitation suppliers, traders, and service providers. And very fundamental to this, and I think this is something that's really come up a lot in today already, is market strengthening action. So we're talking about the enabling environment, regulatory aspects, etc. So there's a bit more about that on the next slide. So WHAM, Sanitation Enterprise Development, what does that mean? Well, understanding the market. Again, that was coming up in my mind quite a bit already in terms of understanding the market, the local context of supply-demand mechanisms is really important. And that's where market mapping and assessment, we've produced some similar diagrams to the one that Lucy showed in terms of, in the middle, the supply chain, the sanitation chain, and above that, the enabling environment and the supporting infrastructure. So it's very much a similar approach, which is called emergency market mapping and analysis, which has there are a lot of similarities to what Lucy was presenting. So in addition, it's about developing viable business models, so looking at the commercial aspects, business planning, and part of that supporting, again, thinking about the implications of emergency, helping businesses with contingency planning. So at the same time as developing the market and supporting businesses within the existing context, helping them think about, well, what happens to your business? Because obviously during a disaster, it's not only the households who are affected, it's also the businesses themselves that are affected. So how do you plan effectively for that? On the enabling environment, market strengthening actions related to regulatory issues, legitimization of small-scale service providers, monitoring of sanitation markets, strengthening the market regulatory framework, and working with the Philippine Chamber of Commerce. Enabling the poor to access sanitation, two main elements to this. One is on microfinance. I see Sophie taking notes. I'm a bit worried now. So this involves developing partnership with microfinance institutions and providing finance through those MFI loans to cover construction costs with an interest rate of 2.5% per month and loan repayments in small weekly instalments. So this is quite a new area for MFIs. So it's required a lot of work by Esther and her team to be developing that relationship with the MFIs to enable them to provide this service. Another area to supporting this is sort of looking at the poorest of the poor. So microfinance is pro-poor orientated, but it's not only it doesn't address the poorest of the poor. So vouchers for the poorest to give them the ability to procure materials for and components for toilets. In the interest of time, I'll move on. So our current perspectives in this are looking at additional financing facilities. So not just microfinance institutions, but also cooperatives, saving groups. Social franchising, I think, is a very interesting area. If we're looking at one of the issues that came up this morning, I think George mentioned it in terms of the small-scale actors not really having so much credence or weight within the market. So franchising enables them to work together and give the brand a bigger name, which in effect gives better marketing, but also gives more strength for those organisations to be more visible. Tapping into municipal funding. As we recognise, public finance is important for sanitation development. So how can we supplement the investments from households themselves, from other sources with municipal finance is critical. Septis management, I've already mentioned. In terms of our current challenges, helping finance organisations to see wash-related products as profitable is a challenge. Organisational attitudes and skill set to work with private sector MFIs. So that's particularly, relates to Oxfam as well as other organisations. So it's breaking that mould whereby NGOs seem to be providing, particularly in the humanitarian context. It's that tension that I mentioned earlier about our role as providing humanitarian, saving lives and a humanitarian role, and then moving into a much more of a commercial world. And very, very important with, I think, in all situations is coordination and mainstreaming of approaches. So obviously, if we're promoting one particular approach and other agencies are promoting something different, that causes problems. So wrapping up, so you'll see that we effectively started in the emergency response phase, but we've moved on. The approach developed as we moved on, became more sophisticated and more in line with the sort of approaches that we're hearing about sanitation development from a non-emergency response perspective. And what I would like to explore more would be how we then link back again. So in terms of contingency planning, I would like those working in the development sector to be thinking much more about what happens to the systems that they're promoting and helping to finance in the emergency situation. And I want myself and colleagues within the humanitarian response world to be thinking more along the lines of how can we learn from the experiences in the development sector. And that's my aspiration, is that we can get together more and we can learn more from each other. And I think that has benefits both in the immediate response in terms of efficiency of delivery, effectiveness of delivery. If we're working with market actors, it's enabling opportunities, livelihood benefits and commercial benefits for those businesses with a combined multiplier effect, which hopefully would not end up in the situation that I mentioned earlier in Haiti. So we want to be looking towards economic development in post-disaster situations. Respect and many, many thanks to the team working on this in Philippines. So these are Esther's colleagues, and there's Esther, and her email address. And if you can't read that, I'll be quite happy to pass that on to you. So Esther will be able to give you much more detail if you have detailed questions that I'm not in a position to answer. Thank you.
Great. Thanks very much, Jonathan, for a very interesting presentation. So really focusing on that humanitarian development interface. Any short questions of clarification and initial debates, and then we can just cut a few minutes into the tea break for these few initial questions. And then, of course, a reminder that after the break, we'll be having another panel focusing really on this interface idea of the development humanitarian side. So if you have some longer questions, do feel free to save them for that panel. But let's start with Mansour and then go to Nat. No question for Nat? Only Mansour. Okay, go ahead, Mansour.
Thank you, Jonathan. I think I'm trying to read and understand these things with IMC, and the issues you raise are really important. And as you know, big money and number of people are involved. But there are three things which really you said are really key to take us forward. One is the way the humanitarian sector within donors, with relief organizations, and also with governments is structured. And that is very much, in my opinion, is structured not to collaborate. Within the humanitarian organizations, you got logistics, you got procurement, but then you got advisors, and then you got program team and fundraiser. I think that's also lead to number of challenges. And I think the second point is the shortage of time and to save life should not be seen as an excuse not to build more sustainable system and not to develop. And one clear evidence of that is many organizations, when they go there, it's normally not their first time presence or first time. They all have previous information, data, partners, and all that. The trouble is, because of the structures, another reason they don't use it. And I think that's another failure. So it's really a key issue, and I'm really excited after hearing that how we can work together. But there's a lot of demand in overcoming these bridges. Thanks.
Thanks, Mansour. Any questions from the online audience? Now's your chance. Otherwise, if there's anyone here in the room. Okay, Jonathan, go ahead.
That's good. I can't cope with too many questions all at once, so that's nicer to respond. Well, I guess I don't have an answer as such to that, Mansour. But yeah, it certainly struck me after a fair few years working in development to be joining Oxfam a year ago. And it did strike me very clearly how much these worlds are quite different. Well, not different, but when we're talking in specific terms about the funding mechanisms and the way, like you referred to logistics, huge apparatus and a lot of staff and a lot of systems in place to be responding in these emergencies. And there is good reason for that. It's easy for me to sit here and sort of say, oh, well, it should be different and such like. But I've got colleagues here. Jenny's here, my colleague who was here on the panel earlier, and Yola, I think, is here too, my other colleague. So they have much more experience of the emergency situation than me. But I think there are opportunities, there are ways forward. And I hope my presentation gave some sort of illustration of. There's Yola over there. I hope the presentation gives some indication. And Oxfam is by far not. We're not the only organisation to be working towards these objectives. I know IRC, ACF. I could go on. We're working together. And we really want to establish, stronger lines of communication, and that was really very much one of the key things for, bringing together this group today. And I hope we will be able to, move on in the direction that you're alluding to.
Thanks. We actually just had a question from the online audience. I think you may have partly answered it. Polly from Luwat was asking what it will take for agencies and organizations to move away from the traditional approach to humanitarianism. with the OCHA report on humanitarian effectiveness, giving a clear message on the need to change approaches. You've kind of, I think, spoken to it a bit. Maybe we can come back to it in the panel unless you had any immediate remarks. Make a good kind of framing for the panel, again, of how we can move away from the traditional approach that Jonathan has highlighted is the challenge we're facing in terms of this humanitarian development interface. So without any further ado then, thank you for your patience in this session. We'll take a short tea break for you to refuel, and we'll be back, please, promptly at 2:45 for the next panel debate facilitated by Rick Bauer. Thanks very much. Cheers.